Hello, I'm Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Center, Navi Peth, Pune. Today I'm going to talk to you about something in test tube baby which is known as minimal ovarian stimulation IVF procedure. Now it may sound very complicated to you, but it is basically a minimal stimulation protocol and followed by a IVF procedure. So in short, it is also called as low cost IVF or colloquially called as mini IVF technique. Now what is done in this is that normally we know that during the test tube baby technology like IVF or ICSI, patient comes to the hospital from the first or second day of her menstrual cycle and she takes injections for 10 to 14 days every day, after which she has developed follicles in both her ovaries, which we remove under anesthesia with the help of ovum pickup operation, which we have discussed previously in our videos, and we take out the eggs from the lady and we fertilize these eggs with an IVF or ICSI procedure by her husband's sperms. Now what is different in a mini IVF or a low cost IVF or minimal ovarian stimulation IVF is that the patient ovarian reserve is much better as compared to elderly patients. So the patient might be a young patient who has failed more than 3 IUI cycles and needs an upgrade to a IVF technology. But the beauty of this is that the patient does not require full dose of injections. That is, if a normal patient requires around 450 to 500 units of injection, this patient in a low cost IVF will require somewhere around 150 to 225 units of injection. That means the dose of the injection is reduced by half and hence is the cost. So because we are giving very low dose injections, we do not get too many follicles, we just get the good quality and limited number of follicles, from which we retrieve the egg by the oocyte pickup and fertilize these retrieved good quality eggs with the husband's sperm to make a child. Also, the difference in a conventional IVF versus a low cost IVF is the number of embryos, because we know that we are targeting limited number of good quality eggs. We get around maximum 2 or at the most 3 blastocyst embryos, while in conventional IVF many a times you do get even up to 6 to 7 embryos and you might have to freeze the extra number of embryos for future. So in case you are a candidate who has failed IUI more than 3 times but who are contemplating an IVF, and in case you are a fit candidate to fit into the low cost IVF or minimal ovarian stimulation IVF, talk to your IVF physician about this and get more information whether this technology would be right for you in order to save the cost of the procedure and to get a comparable good result. Thank you.